Right there, let's continue our discussion. When the rollout of COVID-19 vaccines began in developed countries in the middle of the year 2020, there are fears that the African continent will again be left out of the distribution process, as well as it was experienced in the past. But the Nigerian government has since promised that the country would receive 100,000 doses of Pfizer's vaccine by early February. However, challenges of storage, which requires a cool temperature, have casted a doubt on the country's readiness to roll out the vaccines, particularly to the rural areas. In its defense, the country's Director General of National Primary Health Care Development Agency, Dr. Faisal Shaibu, notes that Nigeria has found a way through its ultra-cold chain equipment ready to provide a minus 70 degrees Celsius requirements for the vaccines. Let's now analyze these challenges and possible solutions from an angle of an expert in the pharmaceutical industry. Joining me now to discuss this via Zoom is the President of Pharmaceutical Society of Nigeria, Mazi Sam Ohabuwa. Thank you very much for your time. I greet you. Good afternoon, sir.
Thank you very much. Good afternoon. Listeners and viewers.
Yes, let's start with our system at the moment, our healthcare system in general, as we expect the vaccines to come in. How prepared are we? You are a professional in all of this. Have we put in place all that is necessary for us to receive our vaccines if it happens that it comes in today or tomorrow?
Well, I don't think any vaccine is coming today, maybe tomorrow, but certainly not today. Are we prepared? Well, maybe to some degree, but we are not adequately prepared. Anybody that tells you that we're adequately prepared is being economical with the truth. Because we have, even for countries that are sophisticated with the infrastructure, they will always have challenges dealing with the requirements for these mRNA vaccines that require very cold storage. In Nigeria, all we have had is storage for between 0 to 4 degrees for the purposes of the usual vaccines, and we use our refrigerators and cold chain. They are not designed for 50 degrees minus 50 degrees or 70 degrees. Government says they have procured 3 big freezing equipment in Nigeria. That's fine to receive the shipments, but how do you take them to the local government? Through the cold chain that needs to be recharged, through electricity and formation of ice blocks that will keep it cool. But when you're talking about minus, it's not what ice blocks can keep cool. So we have a lot to do, and I'm afraid that we haven't, we're not quite ready, but I'm not suggesting we should not get the vaccines until everything is set, but let us admit that we have great challenges to take these vaccines to the. If you want to vaccinate people in Lagos and Abuja, maybe we can provide facility. But this disease does not differentiate between people who live in local governments and people who live in the states. I know there are some areas that there seems to be greater preponderance, but that's just because they are reporting. In many of the local government areas, nobody reporting anything, but they are being infected and people are dying. Mortality is going high. So I'm not blaming this government because we were never prepared for this kind of emergency. Most of the world was never prepared. How much less a country that cannot guarantee 12-hour electricity to anybody except those in certain parts of Lagos or Abuja. So we have a lot of work here to be done, and all of my points in, I believe government is making its best effort to make sure we are not left out on this vaccine issue. But the truth and the basic truth is that we are not prepared, fully prepared, and the vaccines will never get to, in the short to medium term, to most of the outlying parts of our country, the 774 local governments. And even if you go to local government headquarters, it's going to go to the towns and villages. Some local governments are like states in their size, and even in some of them in their population. So it's a lot of work, but the important is that we have started to make some preparations.
Now, if we were to assess the effect of all of these negatives, talking about the second wave, the numbers that keep trickling in every day we get from the NCDC, how is this affecting the pharmaceutical sector in general? We know of interventions before we move into that, but in generality, can you take us through the effects from the first phase or the first wave of the vaccine, then we're now to the second wave? How has it been on the industry in general?
Well, before I need to say first and foremost, if you listen to the United States, when they are talking about distribution logistics, they are talking about taking the vaccines to pharmacies. I don't know whether you've had that. It is the pharmacies through which they are distributing the vaccines, but Nigeria has no use for community pharmacies. They are not in their line. The only line they think about is health centers and maybe some government hospitals. They are not using community pharmacies that are close to the people and that have the ability to provide even some of the refrigeration that we're speaking about, and preservation and logistics. We have a country that does not recognize the different components of its health system. A country that is, if it were able to harmonize all that the private sector brings into healthcare, all that the different sectoral professional groups into healthcare, we might be mitigating or offsetting some of our shortcomings. But when Nigeria is dealing, they are dealing with government. If it's not government, everybody else is on their side, on his own. So America is using pharmacists as their logistics route to reaching the people rapidly, not just hospitals or health centers. I think that's one thing I need to put on record, that Nigeria is not recognizing appropriately the resources that community pharmacies and even other healthcare opportunities. I mean, you have private medical laboratories. It took forever for NCDC and PTF to allow a private laboratory to participate, even in evaluation, in testing. And it keeps embarrassing me, because it's like you have a lot of resources, you ignore part of it, and you're focused on a minor little part of the resource base you have, and you use that to measure our performance. So that's the first thing. I think government needs to orientate itself and begin to look for the facilities, because whether you're a private facility, you're a government facility, you are a national asset. You belong to the country. And the leader of the nations or leaders ought to recognize that and ensure that whenever we're doing things, calculating our capacities and our capabilities, we should first, how much capacity and capability does the public sector have? How much capacity and capability does the private sector have? Otherwise, you just treat the private sector as if they were observers, or you only come to them when you are no longer finding an opportunity to do other things. So as well started with them ab initio. Now, having said that, the COVID has affected everybody. I don't know any company or any business, any sector that has not been affected. Of course, for the pharmaceutical industry, it's a two-edged sword. It has created some positives and created negatives. Positives is that it has spurred interest in the sector. For the first time, Nigerian government, through the Central Bank of Nigeria, is providing special funding to the pharmaceutical industry to help them build up capacity, capability, and have even begun to provide some funding to research and development. This is landmark. It never happened before. And so we must acknowledge that that's the positive side to the industry. But outside that, we are subjected to what other industries are subjected to. When it's becoming difficult to get raw materials in from China, India, and other countries from whom we depend on raw materials, it's becoming a difficult thing. The conditions, the standards have become longer. And because of disrupted global logistics, sometimes goods don't arrive, raw materials don't arrive at the expected time. And therefore, that affects production schedules and creates gaps in the marketplace. So we are affected. Secondly, because of the requirements for maintaining social distancing, and therefore people are forced now to work from home. And because they're working from home, it's not as easy for manufacturing factories, manufacturing companies, especially companies in Nigeria that are largely analog. Now, in the world where you have a lot of artificial intelligence, you're using robotics and depending a lot on equipment and machinery, it's easy to space people since machinery will stand between them. But in Nigeria, a lot of work still happens by manual packaging, so much manual involvement. And so when you have this difficulty to get people to aggregate, you need to space them, you need to keep them distant, people have to work from home. It will affect production output. So that's other way we are facing the problem. And lastly, because there's a global economic recession, and which are reflected as a recession in Nigeria, so there's a contraction in the economy, contraction in disposable income, inflation is eating up income, the devaluation and depreciation of the naira is eating up the value of every naira that we have. So purchasing power has gone down both nominally and effectively, and therefore demand for products have fallen. And because people are just looking for how to be alive, so they're spending money on face masks, spending money on the cocktail of preventive things that Nigerians are using to protect themselves. So money to spend on other pharmaceuticals has declined. So you have people defaulting who are having to take chronic antihypertensive medication, anti-diabetic medication, and all these chronic illnesses. People are ignoring them. And some of the mortality we've seen in recent time is as a complication of the underlying disease that is not being well maintained or managed, because all effort is how to protect ourselves from COVID. And since in Nigeria, everybody has to pay. Nothing is free. Only very few people are covered by insurance. And even when they are covered by insurance, they tell the insurance does not cover emergencies or crisis. So what do you do? So people are spending from their pocket, and just spending from your pocket when the naira value is declining, when inflation is going high, and when job availability is also declining. You will understand what I'm saying, that the misery index increases and utilization of medicines also decreases. And so you may have companies reporting shortcomings in their expectations, in their budgets, and in their output. That is the way the industries are affected. But like I said, it's a mixed bag. There are some industries that have been wiped out completely. Some industries will take time to recover. But the truth is that the pharmaceutical industry has a very good potential to recover, having received some shots in the arm by the CBN, and also some of the change in policies we've seen from government. Government that didn't fund their research institutes have begun to do something, and I think that is positive.
To ask about that, because the last time we spoke, I remember that we mentioned this 100 billion naira from intervention from the CBN. I wanted to ask how accessible this is, and on the other side, what's the role of digital technology in all of this? Talking about also helping improving dealings in the pharmaceutical industry.
The thing is this, that we have found that most of the money has been deployed in terms of allocation, but it has not yielded the desired results, because most of companies need to buy equipment, they need to buy raw material, they need to buy all forms of technology, and they need foreign exchange to buy them. So what we'll find is that many companies have received this money. Some of them, the money is to beside the naira, and they can't get foreign exchange. I've been speaking to CBN, looking for opportunity to talk to the CBN governor. Like, you gave us this money, and you know what we're going to use it for. Why don't you provide us with foreign exchange? So many companies are forced to go and buy foreign exchange from anywhere they can find it at inflated rates, and in this interim, inflation is depreciating the value of the money. So not only inflation, we're also having depreciation of the naira. So what you find now is that if you give me 2 billion
we cannot
naira,
hear you very clearly like before. We cannot hear you as clear as it was earlier.
All right, maybe
yes, loud and clear now. Yes.
You can. You're all right. So I was saying that the way things are going, many companies have not been able to import the raw materials or the equipment because they can't find dollar. Dollar is scarce in the Nigerian banking system, and they are going to buy at inflated prices from the alternative market, and therefore that worsens the situation because there are assumptions made when we are submitting proposals. So you find that the money can no longer buy what you wanted to buy, and you are not also able to translate the money to work early enough to prepare yourself for repayment. The money is not free. So I'm really worried because we are setting the base for inability of the pharmaceutical companies to pay back at the right time when they are supposed to start paying back. Some of them are paying a lot of interest already because interests are being paid right now. But moratorium was kept for capital repayment. So there are difficulties on the road, and I want to use this opportunity. TVC has offered me to appeal to the governor of Central Bank. Since we submitted proposal, every company that received this funding or the loan brought a proposal to say this is what we're going to use the money. And of course, the CBN gave the money essentially to improve capacity and the ability of those companies to manufacture different dosage forms, including products that will be useful in managing COVID-19. And you gave us the money in Naira, and you know what we're going to buy mostly is in dollar. Now we're trying to convert the money to dollar. It's becoming difficult for months. So I'm appealing to you, otherwise the whole purpose will be defeated. If by the time we're going to buy the money, it's of no value, and we'll buy from the primary market at high rates. Therefore, we're not going to get the same value we were hoping for when we submitted the application. And therefore, the benefit to the common Nigerian will now also be compromised. So that's my appeal. So I know they have approved many, and many have received the Naira, but they can't get the foreign exchange to bring in the raw materials or the equipment at a timeous manner.
I want one way. If we can do this in 1 minute, why are we still having adulterated and illicit drugs in the markets? Many are complaining about that. What is happening? What's the society doing about this?
The society is working with NAFDAC to increase regulatory oversight because, as they say, armed robber not be spirits, now human being. So fake drug manufacturers and fake drugs cross our borders. And you know, you have a border, there's so many borders in Nigeria. The ones that are manned cannot stop smuggling. Then the ones that are not manned, you can then imagine what would be their situation. Our border controls are still very porous, and therefore a lot of illicit, illegitimate, substandard, and fake medicines cross the border, along with other things. The other day, NDLA was able to catch a big haul of people trying to sell illicit drugs. So that's the same way. Those who deal illicit drugs sometimes translate the money, and one way or the other, they buy illicit medicines. And it's just the same gang. So the reason this is happening is that the regulatory framework is not strong enough. NAFDAC is not well funded to be able to have the equipment. And I just spoke about digital. My friend, in most places in the world now, we're using intelligence to preempt and prevent crime. But here we don't. We can't even get CCTV working in many of our ports or many of our entry points of the nation. So my point is that NAFDAC is trying, but it doesn't have sufficient manpower, not as it sufficient technology because of inadequate funding. And I pray that we will pay more attention to this area. And of course, we know the basic challenge Nigerians have, and that's the challenge of corruption. That corruption is affecting everything that we do in our country. The endemicity of corruption, again, that is an issue which may not be solved in one day, but we need to draw attention that it's also part of the reason why you have the wrong things happening, and it's not only medicines importation, but also in other aspects of national life.
I thank you very much for your time, President of the Pharmaceutical Society of Nigeria. I appreciate this. Thank you for joining us on Business Nigeria.